Executive Committee member for Health, Dr. Joseph Epem, that we will ensure uninterrupted availability of health products in all our health facilities, because this is the commitment that the Governor of Turkana, His Excellency Jeremiah Hamais Napotka Lumorkai, and His Excellency Dr. Joe Derus gave to the people of Turkana. The supplies received in the last order were projected to take us until September. You'll recall this today is 1st of September. And through a proactive approach adopted by the Ministry of Health Services and Sanitation and the Directorate of Health Products and Technologies, we have quantified and forecasted that in the next 6 to 8 months, we shall need 120 million worth of health products and technologies. And that, ladies and gentlemen, is what you see in front of you. I want also to reiterate what His Excellency, our Deputy Governor, mentioned, that when we talk of medical supplies, it's never just about drugs. We have pharmaceutical supplies, which you guys call drugs. We have non-pharmaceutical supplies, which include syringes, jig, antiseptics, name them, X-ray films. We have things to do with vaccines. We have to do things like laboratory reagents. And all those, they constitute and equipments, they constitute what we call medical supplies. So this represents the county's investment in ensuring that our people have continued access to life-saving pharmaceutical drugs, medical products, and other essential commodities for this financial year. Because after all, what is it that takes people to the hospital? It is pain, it is pathologies, which are diseases, and we need to ensure that we are robust enough to ensure that we cater the need of our people whenever they go to our health facilities. The order on this consignment is based on the actual needs generated from 234 health facilities. Mark my words, 234 health facilities. They were packaged in Kemsa, Nairobi, purposely for specific health facilities, and they are not supposed to stop anywhere except and until they reach those health facilities, including the hard-to-reach areas of Longech that have been affected by Lake Turkana overflow. Of Namukuse, we shall ensure that those health products have reached there under the principle of what we call the last mile principle. In addition, we are proud partners and we acknowledge the recognition of the county by the Kenya Medical Supply Agency. You will recall that last time we had a meeting here, in the whole country, Turkana County was recognized in terms of commodity management as the best county for that. And we received a trophy and also recognition of our county pharmacist, Dr. Brian Muyokani, as the best county pharmacist in terms of leading his county in commodity management. What this demonstrates, in my view, is our prudence as a county government in the management of these commodities, enhancing accountability, and in as far as I'm concerned, reducing wastage. Together with other stakeholders, we can bridge any gaps that may exist in the health supply chain. Our ultimate goal is to make sure our health system is strengthened so that no member of our community, and mark my words, no member of our community is unable to access healthcare services due to lack of HPT, both for diagnosis and treatment of their pathologies in public health facilities in Turkana. Equally, I want to assure members of Turkana and of the Fourth Estate that these commodities, they are not supposed to go only to public health facilities. They are also going to faith-based organizations, including Catholic facilities, PAG facilities, AIC facilities, RCA facilities. And in terms of level 2, which are dispensaries, and level 3, these drugs are supposed to be for free. And in level 4, which are sub-county hospitals, they are supposed to be offered at highly subsidized rate. Allow me this moment to sincerely appreciate these senior managers who are standing behind me for the robust effort they have put in terms of management, collation, consolidation of the medical orders that came from the sub-counties, and also to appreciate our healthcare workers across the county. The healthcare workers of Turkana County are the backbone of our health system. Day in and day out, they continue to serve our hospitals, health centers, and dispensaries with unrivaled professionalism and dedication. The commitment has ensured that the people of Turkana County access highest attainable health standards as envisaged in Article 43A of the Constitution of Kenya. I encourage them, wherever they are, to continue upholding ethical and professional standards in this noble service to the people of Turkana. But however, let me also point out this. The security and rational utilization of these commodities is a delegated responsibility by the governor and the deputy governor and the people of Turkana to our hands to ensure that all of our health facilities have all essential health products to be able to cater for the needs of the populace. We must therefore not permit pilferage, theft, irrational use, or wastage of any kind. We know, and from the discussion that we've had in the past 2 months with the healthcare workers, that we will continue monitoring and following up and tracking these commodities to ensure that they have been used and used very well, up until every tablet, every vial, and every medical supply has been accounted for. And individual responsibility shall actually be accorded to all healthcare workers. So let us safeguard all these health commodities with the seriousness they deserve. To our community members, I call upon you to continue collaborating constructively with our healthcare workers. Let us work hand in hand to ensure that these products are used responsibly and that they reach those who need them most, and ultimately help us achieve healthier and stronger Turkana County. The phone number that we gave for you to sound your complaints, it is still active, and we encourage you to continue using that number. The ones who have already called, we have acted literally on all those complaints that you provided, and it has helped us to improve healthcare system in this county. Therefore, today's flag off by His Excellency the Deputy Governor, Dr. John Nerus, is not just about delivery of medical supplies. Far from it. It is about reaffirming our county's commitment to investing in the health of our people. It is about strengthening trust in our health system, and it's about taking yet another step towards achieving universal health coverage for all. With those remarks, allow me to invite His Excellency, the Deputy Governor, to officially flag off these medical supplies. Thereafter, we are going to randomly check this. There are 9 lorries. The ones